Radio Solent.
Very good morning to you. It's 7:34. Now, some really cool innovation is taking place in Southampton as far as knee surgery is concerned. There's also a chance to take part in a trial for a brand new technique that's being pioneered. Let's find out more and talk to Mark Frame, an orthopaedic surgeon who works for Southampton General and also the Wessex Knee Clinic. Good morning to you, Mark.
Good morning. Good morning, Alan.
I knew this was coming up, this feature with you. I know that you're a brilliant knee surgeon. I didn't have the capacity to click on the YouTube link of you doing your amazing work because I find it all a little bit too much. Do you get a lot of people like that? You do something that's another day at the office, other people think, I can't handle that.
I must admit, it's not something that people tend to talk about. Actually, it's amazing. A lot of our patients like, particularly the arthroscopy stuff, so the little camera, they often like a copy of the video and enjoy watching what's happening inside their knee. There's no blood, there's nothing gory, so it's not too bad.
Yeah, sure. I mean, I watched the Andy Murray documentary, and he had a hip operation, of course, a hip replacement, and he wanted to know exactly what was going on. I think if it's happening to you, you're after as much information as you can get. Tell us about this NanoScope you're using.
So this is fantastic. It's interesting because everybody's heard of an arthroscopy pretty much, or a camera operation for your knee, and actually that technology has not really changed from the time it was first introduced. So the scopes that we actually use still have an eyepiece. Now, nobody actually puts their eye and looks down the scope directly anymore, obviously, but that's how much it hasn't changed. And now, the size of them is about 6 millimeters. Now, that sounds quite small, but actually just over half a centimeter is quite big when in context with your knee. And this new camera is just larger than a needle. So it's almost like doing an injection into your knee. It's less than 2 millimeters and gives us the same view.
And forgive me for, I should have watched the video, but I just couldn't. But the camera enables you to look, to see, to investigate. Does it also enable you to do any surgery, to stitch or to cut? Or then have you just got a great landscape of what you now know you need to do?
No, so this is really just replacing what we've had before, but in a much smaller fashion. So we've got instruments as well that are even smaller, so the same sort of size as the camera, so tiny little instruments, and everything is disposable. So you open it, use the camera, this incredible HD camera, and then at the end of the operation, everything goes in the bin, and that's to the degree that the technology's moved on.
Focusing on knee surgery then, does that mean the future for someone who's having an investigation like this would be more simple, that there's no general anaesthetic, it's a lot less invasive, they may not even feel it happening?
That's the aim of all of this, ultimately, is to make everything safer, quicker, easier for the patient. So with a small camera, you can use this under local anaesthetic, so you could just do some simple injection of local anaesthetic, put the camera in like a needle, and be able to actually look in the patient's knee with them awake, sitting there having a conversation with you, rather than having a general anaesthetic. So it's quite incredible.
Wow, it sounds amazing. You can see it online. If you look for Mark Frame on YouTube, and he's got lots of videos about the work he does. It's quite spectacular. Let's talk a little bit about this trial that you're starting, using metal implants to replace cartilage. Talk about that.
So, again, people have heard of total knee replacements, partial knee replacements. There's an unfortunate group of patients who have an otherwise completely normal knee and may have had an injury or something happen and lose some of that very specialized cartilage that covers the surface of your knee. That's the cartilage that allows your knee to glide and move. And once you lose that cartilage, your body can't recreate that and can't replace that. And that's kind of the holy grail of orthopedics, is finding a means of growing that new cartilage, but we're not quite there yet. So often people will be stuck with a knee in pain, and there's no option for them. And this trial is trying to compare something that we know that's okay, which is called a microfracture, but it doesn't last forever, and comparing that to these very small custom metal implants that are maybe just a couple of centimetres across to fill in that damaged cartilage, rather than giving them a full knee replacement or basically just leaving them with a knee that doesn't work.
Do you think that the day of, and we're straying slightly into the over-curious maybe, so just tell me, Mark, to shut up. I mean, you know what you're doing. I'm wondering whether the day of metal is coming to an end, because we're seeing new polymers being invented, polymers that potentially can repair themselves. Do you think this is the last, perhaps the last decade of metals, and we'll move into something else?
I've done lots of research on lots of different things, including 3D printing, etc. And I'd love to be really optimistic and say to you that there's a magic plastic or something that's coming in that's going to revolutionize everything. But I think, unfortunately, we've proven through partial knee replacements, total knee replacements, that actually replacing cartilage with bits of metal actually works really very well, and gives you the long-term solution to your knee. Our bodies are incredibly clever, and we underestimate how clever they are, because you can have somebody's knee that lasts 90 years. You know, so imagine a piece of your car that doesn't need change for 90 years is crazy. So we struggle to be able to produce something that actually even matches the kind of longevity that your body has. So unfortunately, metal is what we have at the moment.
Mark Frame, orthopaedic surgeon from Southampton General and Wessex Knee Clinic. It's been lovely to have you on the show. Mark, let's finish with this. You're recruiting people for a trial. If you wouldn't mind just quickly summarising what you're looking for and how people can sign up to that.
Okie dokes. So there's lots of different inclusion criteria, but essentially you need to be between 30 and 70, have one lesion or damaged bit of cartilage within your knee, and have not had any other surgery on it, basically. The more detailed information, if you go to wessex-knee.com and have a look there, there's much more information about the EpiSurf trial and the NanoScope there, so that's the place to go.
Mark, thank you. Always lovely to have you on the show.